Just 5 minutes, doctor. Some technical problem. Okay. The problem is solved. Hi. Welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have a problems like thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems even at a younger age. It is not uncommon now for 25 to 35 years old people complaining about hair problems. Most of this problem, if identified early, can be managed well, and much of the hair loss can be avoided. Most of these issues are related to our faulty lifestyle. Today, we have with us Dr. Imran Wali, is a well-known doctor based in Kolkata. Dr. Imran Wali has been practicing as dermatologist in West Bengal for over many years now. Whether you are coming for a simple hair care checkup or for a complex treatment regimen, he always put your interest over complex and impersonal healthcare system and also coordinate the care that you may need from other specialists. He speaks Pagla, Hindi, English to each patient in a way that makes them comfortable. He is currently practicing at Dr. Wali General Clinic, Salt Lake City, Kolkata, West Bengal. Dr. Imran Wali is aware of the need for the patient awareness and education about hair care, and hence spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Imran Wali, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you.
Dr. Hamaisha,
thank you for the wonderful introduction.
Dr. Hamaisha जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, today we are going to discuss the role of vitamins and minerals in hair management. So, when we talk about hair management, hair care, the first question which comes up to our mind nowadays is hair loss. So every one of us is facing hair loss. So doctor, what's normal and when to be concerned for?
Very good and simple question, Mona. The fact of the matter is, when the patient comes to me with hair loss, actually, we at least have 30 to 40% patient हमारे यहाँ में जो आते हैं, this is complaints of hair loss. And it is equal amount with this, the male and the females. They're all concerned about it because hair is also an ornament of the body other than the other. Now, जो पहले चीज है कि we have to study what is the cause of the, go to the background. I do a lot of counseling. हम बहुत counseling करते हैं. Medicines are more or less the same, but the counseling part is very important because they are very stressed out. They are very apprehensive. They have a very low self-esteem, you know. So ये सबको हम लोग को आगे ठीक करके उसके बाद we can go to the next level. Now hair fall हम लोग पहले बोलते हैं कि hair fall happens with everyone, young, old, everyone. And hair fall का there are a lot of factors. One is the internal factor, one is the external factor, one is the mental factor. So you have to declutter the thing. You have to demystify certain things which happens about the hair, which people know. Now आज के दिन में there's a lot of misinformation than proper information. You have easy access to the YouTube. You have easy access to a lot of inconsequential things which people put in their head because there's a lot of time now, and especially after COVID with the work from home, you know. So you have a lot of stress. Now, the hair will fall to a certain extent. Now you can't quantify it the 1, 2, 3, 4 like that, but it's alarming when you can see the hair on, to be very practical. When you can see the hair, lot of hair, when you're having a shower or when it's on the pillow, etc. That is one thing. And this hair loss can be due to various factors. That is where you should consult your doctor. And even if it is a normal hair fall, you should still consult because once it goes, it's very difficult to come back. Now, this is, as you said, Now the hairs are various types. One is for the males, it is male pattern baldness. For the there's alopecia areata, that is on patches you get. Then there's the telogen effluvium, stress related hair. So primarily to make it more simple, instead of going to the didactics of problem of the hair, is that we have to handle the patient as per the situation of the patient, whether it is a middle-aged person, a young person, or an old person. So first we have to go to a lot of other factors for the hair and explain it to the patient.
Okay. So, doctor, is there some everyone lose hair, as you said that everyone lose their hair. So, is there some kind of some symptom like, okay, now the quantity is too much, you should visit the doctor. So, is there something
Yeah,
like that?
yeah, yeah.
Okay.
If you have a lot of hair, you can understand. I mean, 10, 15, 20, 30 hair is not a big deal. Maybe it's 100 or 200. Now, suppose the person, one second, suppose the person has 1,000 hair, and suppose 500 hair goes. It's a very relative thing, right? Hair will always fall. I mean, my hair falls, your hair falls, everyone's hair. It depends on how much of the hair is falling. When you
Hmm.
see a lot of hair falling every day, now this hair fall cannot just be like that. It is a lot of factors, as I said, Mona. The factor of the matter is one is if you have a hereditary thing, if there's
Hmm.
a change of environment, if there's a
Hmm.
heavy exposure to chemicals, if there's a lot of dandruff, if you have a lot of infection on your scalp, you're
Hmm.
asking what are the conditions in which you are going to go. So I'm telling you this. Is it okay?
Yes,
Hello?
doctor.
Okay,
Yes,
fine.
doctor. Yeah.
I want you to understand as simple as I can understand. So I want to
Yes.
make it very simple, and I don't want to go into the very intricate things, which is very kind of boring. I want, like, suppose I'm the doctor, you're the patient. It's like that, right?
Yeah, doctor. Yeah.
So that
So,
people can understand. So
oh,
the bacterial infection, there is fungal infection, there is a hereditary factor. There is a lot of if lot of people do a lot of experiment on the hair. There's straightening of the hair, heatening of the hair. All these lot of things. This causes damage to the multiple layers of the hair. Okay, and then there's a stress related, like it's called traction alopecia. This trichotillomania. You are under a lot of stress and you try to start pulling your hair out. Okay, there's a mental pressure also counts. Then of course there's the deficiency part. Deficiency part, various minerals are there, which is lack of it. We are going to come to that later on after as we progress.
yeah.
There is a
Yes.
lot of disease-oriented problems. So these are the various things by which you have to come to the specialist for the hair. The ultimate decision will be taken by the consultant dermatologist or the trichologist. You understand? So it all depends. You cannot just generalize it. Each individual has a different form of hair fall. You
Mhm.
understand? There's suddenly some people will have a massive fall of hair, some people will have a hair for a prolonged period, or some people have, and diet also plays a very important role. Food habits, it's very important, because if you don't have a proper food habit, see, let's put it this way, forget all this. If you have a good diet, you're going to by and large have a good hair. If you have a good food habit, ultimately you are nourished by what you eat. But now we are not following that. Just medicines is not the panacea of hair, of a good hair. You have to have an all-round approach, a holistic approach to the hair fall. Is that okay?
Yeah, yeah, doctor. Yeah, very informative. So, doctor, as you said, diet is very important. But nowadays, we all are going through a faulty lifestyle where we, work late night, don't sleep at all. So is there the question comes up like, can a person lifestyle play a role in hair loss?
Very much. Person's lifestyle has a very see when the patient comes to me, I first tell them about their lifestyle. Trust me. That you have to have a balanced lifestyle. You have to sleep early. You have to sleep a minimum 7 to 8 hours. Your body needs rest, whether it's your hair or your skin or everything. You yourself need rest. If you're always stressed, or bad food habits like a lot of excessive smoking, caffeine, excessive drinking, all these causes a lot of problems for the hair. So lifestyle, as you say, plays a very acha, lack of exercise. Then balanced diet, not of balance. You have a lot of food which is uh, uh, trans fat oriented food. So ultimately it affects your hair, not only your hair, your skin also. Why will you have a loss of hair at such a young age if you are not living, if you are leading a good and healthy life? By hand. Now heredity comes to play, means it is a hereditary thing. Okay, that's another different matter altogether. That is the male pattern body. But still you can retard it to a certain extent. But if you constantly have a bad lifestyle, it's going to affect your whole system, and that will cause in English is okay, or should I say English, Hindi, whatever?
Doctor, Hindi, English, both is okay.
Okay,
Yeah.
so actually I'm very comfortable
Yeah.
when I'm
Yeah.
more or less when I'm yeah. ठीक है.
Yes. Yes.
So
Very,
ये,
very clear.
yeah, it's okay now. Am
Yes,
I clear?
doctor. Yes,
Yeah.
doctor.
I'm a very informal guy. I'm not into. I do a lot of shows and this and that. So it's not a big deal. Okay, I explain things with a little bit of humor also. So that's okay, right?
Yeah.
Um, so these are the things, and people are very worried, And the worst part is when other people, their friends or their colleagues, they stress them out more. Oh, you're losing a lot of hair. You're losing a lot of this, that,
Yeah.
or that kind of thing. So they freak out. Then they come running. Plenty. Believe me, when I started my practice 30 years down the line, 1993, I started my practice in July. That time, I never saw so much of uh, people having fall of hair for whatever the reason. Maybe the awareness was not there. Maybe they were, they took it to granted about that this thing. Now the awareness is there, but the lifestyles have changed. You have people working up till 2 o'clock in the night. It
Mhm.
affects the skin. It affects the hair. So all this. See, I am not going to go into the dynamics of hair and this and that. People are not interested. People are interested. This is my problem, and what kind of treatment can I have? So as we
Mhm.
progress, and as you question me, which you're doing it wonderfully, as we progress, we are going to answer slowly, so and unravel the whole thing. Is that okay?
Yes, doctor. So constant bad lifestyle affect hair problem,
Yes.
affect hair.
Yeah.
So
Yeah.
yeah. So, doctor, when we are talking about hair loss and general causes and all, so the question comes up to the mind that what are the medical treatment option available for hair loss? Is there some non-surgical or surgical or topical, or is there like oral also if we just can take and get the hair problem solved?
Okay. Now, when we start the treatment, we do a more or less some kind of test. One is the thyroid test, one is the sugar, one is the if it's a lady, it's the follicle test, the FSH, LH, all this kind of thing. Then one is, the iron level test, which I don't do much, but you can, the ferritin level. Also the vitamin D3. Okay. Now, by and large, I've seen even if the ferritin is okay or a little low, that's also the iron level. But D3 is increasingly low for some
Mhm.
reason.
Mhm.
Vitamin D3, you know that. And other things are also there, which is higher. So first you get that picture clear, and then you can start. Basically, there are a lot of topical medicines which you can use for the hair, and also there are a lot of nutraceuticals which you can also use for the hair, which is also helpful for the hair. This
Mhm.
is primarily the first uh, stage of treatment is lotions and
Mhm.
oral medicines. Oral medicines of
Mhm.
a very fact of various types, and of course the lotions are there. There are lots of lotions which are there in the market. The medical lotion which has to be applied. The most important thing, Mona, is that you have to tell the patient to have patience.
Mhm.
That is very important. You will not get a result in 2 days. You will not get a result in 5 days. And you have to have patience. If you don't have patience, you can keep jumping from one person to the other, and you get confused, not the other person. And you end up applying a whole lot of medicines, a whole lot of tablets. End of the day, when you don't get the result, you get frustrated.
Mhm.
So it's not a 2 minute thing, that in 2 minutes you have your results. It will take its own time, but you have to have the patience and the faith for your hair to come back to normalcy and also improve your lifestyle. Okay.
Okay. Okay, doctor. So, when you were telling us the medical options, so you said nutraceuticals. So, doctor, what is nutraceuticals, and what is the role of nutraceuticals in hair health?
Yeah, nutraceutical nowadays is very important. Like biotin is very important for your hair. Biotin is very important. You have a lot of vitamin D. Then you have a lot of all these vitamin, uh, your B12. These are all, even to a certain extent, iron is also very important for your hair. So there are a lot of medicines which you get from the companies, your or other companies also. and which has to be taken. It basically acts as a nutrition to the hair, the added nutrition to the hair, which you don't have, which is lacking. So that is one thing. And then the lotions are also there. And also you have to respect you have to regularly shampoo your hair. Shampooing has by and large nothing to do with your follicle. If you have dandruff, you have to get rid of the dandruff. If you have a lot of bacterial infection, you have to get rid of the bacterial infection. So first you have to handle those which are causing the hair fall. And
Okay.
then you come to the next part of making your hair grow as much as possible. See, whatever is gone, what hair is gone cannot come back. But
Yeah.
what hair is there and what I can do to develop it further, that much we can do. And that's it.
Okay.
You
So
understand? And nutritionals play a very important role nowadays. Yeah. And antioxidants.
okay. So basically, the root cause of the problem should be known to get the problem solved. Uh,
Yes.
so, doctor, like you said, nutraceutical. So, you are also letting us know something like vitamins also. So, what are some of the vitamins which are used in the management of hair loss problems like alopecia?
See, there are a lot of, see, one is vitamin E is a very important vitamin, which is, it, it acts as a supplement. Isn't it? Then vitamin B12 is also there. Then there's folic acid. Then there is your, wait, I'll just tell you one second. They are GLA, okay, multivitamin, minerals, amino acids with millet seeds, you know. So, and also the grapeseed extract. Your company has a very important medicine which we write. Am I supposed to say the name? No.
It's okay, doctor. You can say because it's our
Okay.
yeah.
Yeah. I also write it regularly. For girls, you have a Eva, Caraglo Eva. For men, you have the men. And this is it's very nice. So these are the composition, these are the things which you use a lot. I mean, I use a lot. And it's good, it's good. And they also have a very high concentration of various other factors which help in the growth of the hair. And the most important thing is it is also gluten free.
Okay.
That's a very important. Yeah. So these are the things you have to bear in mind, and this is what is the way it is done. You know, you also have a before you had one Caraglo plane, which was also
Yeah.
very good. It's very good. But now you have separated it. Yeah.
Yes, doctor. So, like you said, vitamins are important, and we are also having poor diet and nutrition. So, doctor, is minerals also play a role, or minerals like iron, zinc, copper, do they promote hair growth?
Yeah. They promote hair growth. They promote hair growth, and 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 your composition has a lot of this iron and the other minerals which is there, which is helps in the hair. Because I have given your the medicines for say about 3 months. You just can't expect a result in a month. You have to give it for a long period of time, for 3 months, 4 months, and I think patients are quite happy, and they're I mean these side effect is there. Yeah, I mean there is no side effect. So
Okay. So, constant patient with regular medication and consultation with the doctor helps.
patient has to have patience.
Yes. Nice word. Nice line, doctor. Patient has to has patience for a healthy hair health. Mm.
Yeah.
And so, doctor, there are so many vitamins, minerals. So, is it required to take these nutrition as per gender RD requirement?
See, it's very difficult there with this RD requirement, but the thing is, it is all available in the capsules.
Mm.
Okay, the zinc and the copper, etc. Whatever, and also if you take a lot of proper food, I mean the fruits, every fruit has all these vitamins. Every even egg has. If you're a non-veg, egg is very good for your nutrition of the hair. So these are the things which you can always use for hair. You understand? So these
Okay.
are all variety of things which you can use for the hair. So proper nutrition is very important. You know that. Okay, can I add in something? I
Yes,
was
doctor.
other forget. You see this heating of the hair or hair straightening. It's not a very good thing for the hair. It damages the hair, and
Okay.
then no medicines will make it recover to that level. It makes the hair lusterless. It makes the hair thin. So,
Yeah.
and uh, improper washing. You must first point is you must respect your hair,
Mhm.
because if your hair goes, nothing is going to bring it back to that level. It's a
Yes.
natural thing which you have it, so you cannot misuse your natural thing by doing all this experimentation. You understand what I'm saying? Because you're damaging them. So that is also very important. So you have to see medicines are always there,
Mhm.
but with the medicine, you think you have to counsel the patient also about about the side effects of various things. It's your hair, it's your body, you can do that. But it's our job, our duty to always make you aware of certain things, and by which then the patient, it will benefit the patient.
Okay.
Okay?
Oh, yeah. Yes, doctor. So, doctor, we are talking about nutrition, diet, vitamins, minerals. So, is there any impact of stress also on hair health?
Very much. Now, stress, what stress? Is it the mental stress you're talking about? Yes, definitely. If you're not having a good sleep, you're not having a good adequate amount of food. Again, coming back to the diet.
Mhm.
Just see, I'll tell you something. Suppose someone is not leading a good lifestyle and
Mhm.
you are having only medicine.
Mhm.
Will you think you will get your gloss of your hair? No. And you must also exercise. So these are lifestyle, stress related things are very important. Excessive having coffee, excessive having cigarettes. These are all very bad things about hair. Pollution. As it is, we are staying in a polluted society. Our
Okay.
atmosphere is polluted. Okay. Before 50 years back, 60 years, people had such luster there, such
Mhm.
beautiful glow. They never had so much of fancy shampoos and fancy, spas and this and that. So why are you doing it now? Because of the situation of the atmosphere, the global warming. These all play a very excessive heat, excessive cold. These all play a very damaging role on the hair. Now you can't stop that, but then you can stop the certain other factors which are there in your control.
Mhm. Mm. So stress does play a role in hair health. So, doctor, when we are
This is
stressed,
natural hair. Mine is natural hair. No, I'm just saying.
yeah. So, doctor, we are talking about stress. So, at home, हम लोगों की मम्मी लोग बोलती थी, अच्छा आप स्ट्रेस हो, ऑयल मसाज करा लो, थोड़े रिलैक्स हो जाओगे, बाल भी अच्छे हो जाएंगे. तो, डॉक्टर, ऑयलिंग हेयर इज अ बैन और अ बूम?
Not at all. Not at all. It's not at all a bad thing. Your oiling of your scalp is you're circulating the scalp muscle, the scalp skin. So, but keeping the oil for a long time, for the whole night is not good. You must develop a lot of bacterial infection, etc. You can you can oil your hair, but keep it for 1 or 2 hours, and then you can shampoo it.
Mhm.
Yeah. Well, I mean, I would say that I don't oil my hair. I mean, I've never oiled because I find it very sticky, But that doesn't mean the other people, if they oil, oiling is just to set your hair to, give nutrition to the coconut oil, etc. And but if you keep it for overnight and then wash it in the morning, you tend and liable to breed a lot of bacterial infection. So after 2 hours, you can wash it. Yeah, that gives a gloss of the hair. Yeah. So it's
So,
not a bad. I mean, it's not a good bad thing to do it. Right.
okay.
I mean, if you have the time.
Okay. So, people who doesn't do oiling, is it okay? Or we should do oiling because it's good for hair
If,
health.
if, if if you have the time, you do. If you have it alternate days, you do. If
Okay.
you have the time. But I'm not against oiling.
Okay.
I don't oil myself, but that doesn't mean I'm going to tell them other people to.
Yeah.
So that's it. But you must respect your hair. You must shampoo properly, followed by conditioning of the hair. You must
Oh,
have maintained very good um, hair hygiene.
okay. Okay.
Always
Hair
remember one
hygiene.
thing: your natural hair. Can I say?
Yes, doctor.
Yeah, natural hair. There is no supplement to natural.
Mm.
So as much as possible, you have to try to maintain that you see that you have your hair for a longer period of time. See, like I'll tell you, other than these medicines, for
Mm.
certain for certain diseases like alopecia areata, yes, that's a confirmed disease, right? Where we inject on the hair, on the skin. It's called intralesional procedure.
Mm.
For Why do we do that? To stimulate the bulb of the hair for the hair to grow. And coming back to one more thing, when my patients come to me, I show them the picture of the hair bulb. You understand? The hair bulb. Suppose there's one bulb here, then there's one bulb there. Now, in between, you will not have hair unless you do a hair transplant, which is a separate matter altogether and separate subject altogether. So you have to make sure that that hair or the bulb, from the bulb, the hair comes out.
Okay.
When people say, I want a density, they actually don't know this word. What do you mean by density or thickness? This is not a plant. That it becomes a plant, it becomes a huge pear. You understand? I mean, people have a lot of concepts about this. And people say that if you have this, if you have this, people apply a lot of, any amount of all stupid things which is not supposed to. You can't blame them because they are always into this thing, contraption of the YouTube and seeing a lot of things. But then I always say that if there is a problem of your hair, please consult your concerned dermatologist or your trichologist. That is the most important thing. And then you go to the next step.
Okay. Okay.
People nowadays self-medicate.
Yes. True.
I'm not going by the script. I'm talking extempo, what I've experienced, my 30 years of my experience of my consultant as a dermatologist. Okay. What is the next one you say?
Yeah, so doctor, can you give us some important tips also for hair, healthy hair?
See, for a healthy hair, you must have a healthy mind. That is very important. And you must have healthy sleep. You must have healthy food habits. And the rest, the doctor will take care. And you will have a good growth of hair. You must respect your hair. You must shampoo your hair. You must take care of the hair. Don't experiment with the hair. Don't use just a lot of this. See, the more you apply a lot of fancy things on your hair to make it more, but actually you're destroying the gloss, the glow of the hair. So that is not to be. So you have to change your lifestyle a bit, and then you will get the other things and proper medication and the medicines which I've told you about, really for the girls, for the boys, those kind of things. That is a very important thing.
Okay, doctor. So this discussion was very informative, doctor. I'm sure our viewers would be benefited by it. So, doctor, can we take some live questions from the audience now?
Yeah. See, I tell you before you give language. I told them that I want to tell the basics about hair. I'm not going into the nitty-gritty, the science, the biomechanics. Nobody is interested.
Yes.
I'm a hardcore practitioner. When the patients come to me, I tell them these are the kind of things.
Yeah.
I mean, they are not interested in your, this autoimmune and this and that. They want as much as possible for the hair to grow back as much as possible, right? So I talk to them in their level so that they can understand. The most important thing is open communication.
Yes. So open communication with the doctor and regular consultation can help.
Yeah.
Yeah.
Of course.
Yeah, doctor. So our first live audience is asking, doctor, can you please suggest some hair care tips for people who are active and work out every day? Do we have to wash our hair every day?
Yeah, there's no harm in washing your hair with shampoo.
Yes, washing.
Yeah, if you have a long hair, if you are working out, you must be sweating.
Yes.
So if you sweat, then it's better to shampoo with, it's better to shower and shampoo. No? I mean, you can't keep your hair like that because the sweat goes inside your hair follicle. And the sweat has a lot of salt. Okay. And you can gently, after you shampoo, you can gently blow dry your hair. Not. And another thing, for ladies, I'm not sure whether this person is a gentleman or a lady, but if it's a lady, and don't tie your hair too tight.
Yeah, she's a lady.
Traction. So traction causes a lot of pull on the root. Traction. If you have a long hair. If you have a medium hair, it's okay. Or if you have a short hair or a bun hair, that's a separate matter. But you can wash your hair. I mean, if you're into the gym and if you're sweating a lot, you can. I mean, I don't see any reason why you can't shampoo unless it's cumbersome for that person.
Okay, so
but you should clean. But you should keep your scalp clean. Yeah.
Okay. So if you work out and have sweat in the hair, you can wash it every day.
Yeah, I mean, because the sweat is going to stay on your scalp, right?
Yes. Yeah.
So then you work out alternate days. You don't have to work out every day.
Okay. Very interesting. Doctor, another audience is asking, Doctor, would you request, please suggest me some supplement for hair growth and increase the volume since my hair is thinning rapidly and there is a lot of hair falls.
And we just talked about the supplements, the
Yeah.
biotins, the various supplements which you have, which in your behavior, the
Mhm.
Caraglo Eva, or for the men also, they have the complete uh, chemical constituents of that. And what was the second part?
Uh, that is there any supplement for the hair volume also and hair thinning also, like can
Yeah,
solve
so
that?
hair, hair thinning does not take place like that. If you have
Mhm.
thin hair, by and large, you'll have a thin hair. If you have a thick hair, you might lose a lot of it. Your hair might reduce, but your hair will have that thickness.
Okay.
You can't. This is not a, as I said, it's not a plant that you water the plant and it becomes a big pear.
Mhm.
You will have the, see, when you have a thin hair, the
Mhm.
hair will be always thin.
Mhm.
You might recede. The hair might recede. I might have thick hair. I might have the hair receding, but it's
Mhm.
not going to be thick or thin because of anything. Whatever you have, you will have. But the stress level of the hair will be increased, or the transparency of the scalp will be more, because that is because of the fall of it. So that again, the whole thing comes back again to proper food habits and your proper minerals and proper the minerals which are given by for the maintenance of the hair. That's it. Okay.
Okay. Very informative, doctor. The another audience is asking, I have a dandruff problem since childhood and it has not stopped still, and I see scalp getting dry, and I tried all possible anti-dandruff shampoo and home remedies too, but it keeps coming back. So what should I do?
There is a very good lotion of your company that is Aries Scalp shampoo for the
Yeah.
dandruff, which is very nice. I mean, I have given it to a lot of patients and I've got a lot of good results. So that can be used, and there are a lot of lotions which can be used to reduce the dandruff, because dandruff does cause fall of hair.
Mhm.
You understand? So anti-dandruff shampoo lotion is Aries Scalp Chira. It's a very good thing to use for the for the for the dandruff, and for the if you have a lot of other problems. So it works very well. Yeah.
So, doctor, home remedies, do they work for dandruff? Like,
What are the home remedies? I don't know the
like
what do you mean with the home remedies?
I, like people say, onion का juice लगा लो, lemon लगा लो, dandruff चला जाएगा. So
See,
ये सब
see,
actually
see,
में काम करते हैं.
see. India is a third world country, still relatively poor. I would rather advise the gentleman or the lady to have the onion, much better to have it in your lunch or dinner than to use anything. I'm not very sure about. And yeah, because a lot of people apply a lot of tomatoes, a lot of this. I mean, look at the extent which they go to apply that instead of going to the doctor. That's what I'm coming back to. So, You know, I mean, I always, I'm sure everyone believes the fact that tomatoes and onions are to be eaten. I don't know what this home remedy thing is, and I still don't know the
Yeah.
home remedy. But maybe because they must have somehow got that. But I would recommend whatever onions and tomatoes and mangoes, it is to be eaten than to be applied, and the other parts to be the job of the doctor to cure it. I
So
mean, I
food,
would judge that, yeah, because I
food
get a lot of patients using a lot of stupid things. I mean, sometimes I don't know whether I'm going to laugh or cry. But
items.
so then I tell them, because you have to make them aware.
Exactly.
That's very important. Yeah. And educated people make this mistake more,
Yeah, yeah, yeah,
not the uneducated people. They don't take that risk.
yeah, 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 yeah. Very true, doctor. So, another very interesting question. I have a PCOS and hair loss problem. What do you think about PRP and which treatment should be effective for me? So, PCOS
See,
people need to have hair problems.
I don't do PRP.
Okay,
Okay.
okay.
But if PRP, I'm not very sure how effective it is.
Mhm.
Because I have got a lot of patients, honestly, who have done this procedure, but the results have not come so well. I'm not an expert into this. I am a conventional dermatologist and I will stick by that.
Okay.
You understand? But a person who does this, as I again say, a person who does, I'm sure they must be getting results. So they can go ahead with that. Yes. As far as the PCOS or PCOD is there, okay, that has to be taken. Sorry, that has to be taken care by uh, gynecologists. And you have to reduce your weight also. That's also very important. Your weight also has a place important part. Yeah, that's it.
So PCOS does affect the, like, does PCOS
Yeah, yeah,
cause
yeah. Absolutely. Yeah, yeah. It
hair
does. It
loss?
does. Again, coming back to your question,
Yeah.
bad food habits.
Okay. Yeah. Bad habits. Yes.
See,
Yeah.
I'll tell you something. Wait.
Mhm.
I have treated lakhs of hair problems.
Mhm.
By and large,
Mhm.
95% have been cured by simple methods of treatment.
Mhm. Mhm.
Okay, because I'm into the core of the subject.
Mhm.
You understand? Then, if you can't do, then there is the other alternates, like you said, PRP or hair transplant. And by the way, just because hair transplant or PRP do, it's not a panacea for this thing. I mean, it is not the ultimate thing. You still have people falling hair, lot of falling hair. It all depends on how much a body can take that thing. You know, response
Mhm.
to the hair transplant is also very important, no? So
Yes.
that's
Yes.
very important. Yeah. So it all depends on how much you can go or how much your extent of your desire to make it better.
Mhm. Yeah. Okay, doctor. So, doctor, another audience is asking that he have a problem of alopecia, and do I need to take medication for lifelong? I'm eating vitamins and minerals. What should I do?
So what's the problem? If I have a pressure, I have to hold life. I take pressure medicine. If I have diabetes, I have to hold like this. So what's the problem? And these are all nutrients. These are nutraceuticals. They're very nice, very good. In fact, it will help you on your skin also. Well, lifelong. What do you mean by lifelong? Lifelong is a very term. You can take it for 6 months and then observe yourself. I think 6 months is a good enough time to see the results, how much way you're going. You understand what I'm saying? Okay, so there are certain things, and these are absolutely safe medicines.
Okay. Oh,
The nutraceuticals.
okay. Okay. So another interesting question, even I want to know that this lady is asking that her hair is good in summer, but in winters it become very frizzy and get hair fall. So does the weather also play a role in hair loss?
Yes. Weather does play a role in weather, especially in the winter time. Because winter time your level of dandruff grows faster. And there is no ultimate and complete treatment of dandruff. It's seasonal. It can go, it can come. It's not a big deal that, I did a course of this, again it came back. It might come back. It can come back. I mean, there's nothing to be surprised about it. Because how can you control a weather? How can you control a geographical phenomenon?
Mhm.
It can come if you sweat a lot. If it can come back. So again, you start off with the medicine. So what's the problem? And winter time, it happens more because you see your skin is dry. Your hyper proliferation of the cells take place. So you can shampoo because you're always indoors. You're not outdoors, and so you have to use the shampoo. You have to uh, take care of your hair and those kind of things. So that will happen, but there's nothing to be alarmed about. You have to regularly take care of your hair, and you have to maintain your treatment of your hair, and you have to take care of it. Yeah.
Okay. Okay. There is one more question. We are running out of time, but I'll take these two questions. So, doctor, this person is asking that he follow an Insta page where he found hair detox for healthy hair. So, what is hair detox, and can I use it?
What is this hair detox? I'm not very sure about that. What is it? All these are the hair detox. What I'm giving, what I'm telling you. You understand? If
Yeah.
it is by a doctor, I really don't know. I mean, detox is to detoxify yourself, right? Which nowadays you get also in the hotels when they put in the table detox this water and was which you drink yeah, lately it's happening. But I really don't know what this detox is, so I
Okay.
won't be able to answer this. I have to
Yeah.
go and check it out.
Yeah, it's better not to use such kind of products. It's better to go
Yeah,
to and get the
yeah.
right treatment according to the
Detox
requirements.
means what? You detoxify yourself.
Yeah.
Okay, so
Mhm.
that's it.
So because we are running out of time, I'll just take the last question. Uh, can the split ends be repaired? I also get a lot of split ends. So it be repaired?
Yeah, it can be.
Okay.
Again, the medicine biotins work very well. The various other chemicals that uh, work very well with, but you have to take it for 3 4 months at a time. So it will
Okay.
heal up. Split ends will heal. What does split end mean? The ends split, right? So
Mhm.
it can take and proper, shampooing of the hair and
Mhm.
taking care of the hair. It will get cured. So that is nothing to be alarmed about.
Okay. Okay. Thank you so much, doctor. So,
Thank you.
doctor, would you like to give a take-home message or suggestion to our viewers today?
Take home is that you respect your hair and hair will respect you. Take a proper food habit, proper diet is very important. You must have a proper rest. You must have, 7 to 8 hours of sleep and follow the doctor's instructions. Your diet is also very important. So these are and also to stop this smoking and this alcohol, everything which is it affects because it hits your hair, right? I mean your body and your hair. So these are the things, and be happy that you
Mhm.
have hair.
Yeah, yeah.
Otherwise, hair is going to be a very hairy issue. Hair
Mhm.
becomes a hairy issue.
Mhm. Yeah, I like this line that respect your hair will respect you.
Yes.
Yeah. Thank you so much, doctor, for sharing your expert advice on various issue causing hair problems. I'm sure people will benefit from your advice and will better prepared and equipped with managing hair problems. Thank you, doctor. It was delight to
Thank
have you.
you very much.
Thank you for your valuable time. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today.
Thank you very much. Have a nice day.
Thank you so much.